More children's hospitals across the country being overwhelmed by cases of respiratory illness, stretching resources, while it's unclear what's behind this alarming surge.
This morning, the dramatic rise in respiratory illnesses across the U.S.
I'll make sure we can get you feeling better, okay?
Cases of RSV spreading. The CDC now reporting the age group currently most impacted by flu-like illness are children under 5. Hospitals in 43 states now telling ABC News they are facing a crush of the flu, RSV, and other common viruses. In Connecticut, 10-month-old Lila got progressively sicker with RSV over the last 5 days, winding up in the ER overnight where she was treated with a nebulizer.
She'd been lethargic for more than 24 hours and was showing lots of signs of dehydration.
And in Texas, at El Paso Children's Hospital, RSV cases have spiked 300% since August. Tiffany Pico has spent nearly a week in the ER with her 1-year-old son, Hayden.
It's been very emotional. Sleep has been lacking. Sitting here and hearing the alarms all night go off because his oxygen saturation is dropping.
Health officials say they are now bracing for a possible shortage of beds for the most vulnerable.
This is the pediatric version of the beginning of the pandemic.
And for more now, we are joined by Dr. Anthony Fauci, Chief Medical Advisor to President Biden. Thank you so much for being with us this morning, Dr. Fauci.
Good to be with you. Thank you.
Well, let's start with just how concerned parents should be about these viruses.
Well, respiratory syncytial virus traditionally is one of the most difficult viruses in young children less than 5 years old. We have about 58,000 hospitalizations a year with respiratory syncytial virus, making it the leading cause of infectious disease hospitalizations in children. Have anywhere between 100 and a few hundred deaths per year. We're seeing a surge of it now, more so than in previous years. The infectious disease environment for children has been really warped a bit by COVID, where you have dissociation from contact with people, wearing of masks, being withdrawn and protected. And then as people pull back, no longer wear masks, congregate together, then you get a surge of infections that might have been spread out over a period of time. We're seeing a concentration of them now. This is particularly problematic because as we get into the flu season, you might have a convergence of 3 significant respiratory illnesses at one time in children. RSV, which you just mentioned, influenza, and of course there's always the concern as we get into the winter about a surge of a new variant of COVID-19. So it's particularly difficult at this particular time as we enter into the colder weather.
And as you're talking about those other illnesses, with all of these spreading at the same time, it's a bit of a guessing game for parents about what is making their kids sick. The symptoms are very similar. What advice do you have for people?
Well, for parents who have children, and you had a person there that you were showing on the clip who is describing quite accurately what happens with children. They tend to get lethargic. They may get difficulty breathing because children in that age group have very small airways that can get easily obstructed, making the flow of air and oxygen difficult for them. So if you have a child who gets that way, has difficulty breathing, has lethargy is a very important symptomatology of this, obviously call your physician and get medical care, because as you saw in the clip, sometimes these children require intensive care, including supplementary oxygen.
Dr. Fauci, thank you so much for being with us this morning. We really appreciate your time.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.